History of presenting illness. This is the part where you have to write the stories. These are the principal symptoms that cause the patient to seek medical attention. Each principal symptom should be explained, explored, and well characterized. Each symptom merits its own paragraph with full description, and make sure to use in patient's own words. And you can start your paragraph with according to the patient, or according to my patient. If the patient has a complaint, for example, the patient complains of pelvic pain, these are few points that if you remember these points, it will be very easier for you, and some of them reapply in different symptoms. That when आपको दर्द कब से शुरू हुआ है, since when is the patient suffering from this problem or the complaint she has. Site, where is the pain, ठीक है, right? Onset, was it sudden, gradual, or did it started after a fall, or after she had something lifted that was heavy. Okay, we are considering pelvic pain here. Radiation, does it radiates or move? For example, the pelvic pain she has, does it radiates to her back? Association, is there anything associated with the pain? For example, vomiting or pelvic discharge. Relieving factors, what are the relieving factors that helps the patient? For example, they can be any medications or simple rest. What are the aggravating factors? Lifting anything heavy, walking, running, climbing the stairs, post-coitus. Anything what the patient says can be written in the aggravating factors. And severity, how severe is the pain? You should ask the patient, did the pain increase it since the day you had the pain? Is it increasing? If she says yes, then you can give her a scale to consider. From 1 to 10, she can score her pain. Moving on to menstrual history. First of all, ask about her LMP. We ask about LMP to know if the patient is pregnant or at the risk of pregnancy. What is her age of menarche? Menarche is at you ask at what age did you have your first menstrual cycle, and you should ask about menopause if the patient is at menopausal age. Is her cycle regular? If yes, or if no, then you go accordingly. What is her menstrual pattern? From the menstrual pattern, we ask the number of days of bleeding and length of the cycle. If she says that she has 5 days of bleeding and 23 days of her is the length of her cycle, so you can write it in this manner. So it is very clear that the number of days bleeding is 5 and length of her cycle is 23. What is the amount and the character of bleeding, right? How you can ask this by simply asking how many pads does she use per day. If the patient says that she uses 2 pads per day, that it means that her flow is not that heavy. But if she says that she uses 8 pads per day, so her flow is heavy, and we go accordingly. Ask about foul smell, and if there are any clots, right? If the patient is married, do ask about post-coital bleeding and intermenstrual bleeding, but you can ask about intermenstrual bleeding from unmarried patient as well. But in married patient, you should ask about post-coital bleeding. Post-coital bleeding, does bleeding or spotting occurs after intercourse? This should be your question. Menopause, postmenopausal, from a patient with menopause, ask about postmenopausal bleeding. Any associated pain or symptoms, for example, dysmenorrhea. Dysmenorrhea is, do you have any cramps during your menses, right? And ask about pap smear. Have you done a pap smear? If no, then move on. And if she says yes, then when was it done and what was the result? Now, what should you ask from a menopausal female? First question should be, how old were you when your period stopped? Okay, any symptoms, because the patient that comes with post menopausal patients, uh, the diseases in post menopausal patient are sometimes different from those that are in their reproductive age, because such some carcinomas and some diseases are common in postmenopausal females. So if the patient has had her menopause, then postmenopausal history is important. At what age, at what age did her period stop? Have you experienced any symptoms since your periods have stopped? And did she have you noticed postmenopausal bleeding? Did she notice any symptoms that can be hot flashes, night sweats, vaginal dryness? And this should be asked from postmenopausal females only. Now, obstetric history is that not that much important in gynecological history. So if you make this table and ask these questions, this is more than enough in your gynecological history. Year, duration of pregnancy, location, was it the child delivered in the hospital or at home, mode of delivery, any complication, gender, birth weight, breastfed or bottle fed, vaccination, and present health status. For example, the patient says that her year of delivery was 2009 and duration of pregnancy was 40 weeks, and it was in hospital. It was through the mode of delivery was labor, normal vaginal delivery, and gender was a male, was a female. Birth weight was 2.5 kg and was breastfed, and vaccination was done, and the present health status is that the child is healthy. Okay, in the 2011 the female had an abortion, and 2013 duration of pregnancy was 40 weeks. In hospital it was normal vaginal delivery. For example, any complications, she had PPH, and the gender was a male child, 2 kg, and was bottle fed, and vaccination was done, and the child is healthy. Then her fourth pregnancy was in 2016. It was for 42 weeks duration of pregnancy. Location was in hospital, and mode of delivery was a C-section. No complication. It was a female child, 2.8 kg, bottle fed, vaccination was done, and was healthy. This is all you need to write in a patient who comes with a gynecological complaint and has post-op history. Past history. In past history, you ask about past medical history and past surgical history. Was the patient previously hospitalized? Does the patient have any history of hepatitis, HIV, TB, or is taking any kind of treatment in the past years? Past surgical history. Yes, if yes, then what was the date? What was the location? What were the indications for the history, for the surgery? Sorry, why was the surgery done? What was the type of surgery? And any complications? Any complications during the surgery? And was there any need of blood transfusion? Then comes drug history. Take details of all the medication that the patient is taking, and if the patient is allergic to any medications. If yes, then what is the severity? Is it a normal rash, itching, or proper symptoms? Family history. Ask about any history. At least you should ask about diabetes, hypertension, and asthma, familial cancers, and congenital anomalies. These are a few points that at least you should ask in every history, and they are asked again and again. Moving on to personal history, ask about exercise, diet, sleep, urination, bowel habits. Are they all going are they all normal or not? Are they affected by the disease? Moving on to the socio-economic history. Pakistan is a developing country, so most of the patient in the government setup are not that well off. So there is a question you can ask from your patient, and you would get your answer easily, and they are not offended. The question is, one of our respectable teachers taught us this, that you should ask your patients that क्या आपकी माहाना आमदनी में आपका गुजारा हो जाता है. Well, the patient does not get offended, and it is easier for the student to ask. If the patient says yes, then you should move on, and if the patient says no, then again you should move on and ask these questions. These questions are just to help you out, that you can understand that can your patient afford the medications that you have thought of prescribing, can she afford the tests you want to perform, and how you should move on with your treatment management, what line of management should be taking, that the patient can afford. The patient can simply says that yes, guzara ho jata hai, but maybe that is not true, and maybe the patient says that no, guzara nahi hota, and that may not be true. So you should move on with these questions. A few of these questions will give you a very clear idea of, is it is she true to what she's saying. Does the patient has own house or is it rented. Further, you can add here a question that it is cemented or mud house. That makes it very clear that a patient who lives in a mud house cannot afford much of the treatment. How many people are living and how many rooms. Overcrowding, to rule out overcrowding, so many of the communicable diseases can spread easily. The drinking water that they use, if someone is using Nestle or Aqua, of course they can afford most of their treatments, but if someone is drinking water from a nearby well, meaning that the complaint she has is a communicable disease that is spread through that well or lake. What is the sanitation situation at her home, and are there any pets or domestic animals that can be cause of her allergies or any complaint that she has. So this is the history taking for gynecological history, and if you have any question related to the topic, you can ask in the comment section below. Thank you, and Allah Hafiz.